Hello, everyone. My name is Raina Granberry. I am the Perinatal Equity Initiative Coordinator, which is a state program that has invested in local efforts, local county efforts around the issue of Black infant and maternal mortality. And as will be explained to you a little bit later on by Mia, there are so many disparities around Black birth, and financial support, financial, healthy finances, period, have shown to improve the outcomes for Black mothers, babies, and families. And so we really wanted this to be a part of our program. And now I'll talk a little bit about the AIMM initiative. Oh, I'm sorry. And our great, I don't know why I never say this, our great partner, California Work and Family Coalition, is leading this training. They always come in and do such a great job, but I should start off with saying that. That's our partnership for this program, and you're going to really enjoy it. They're a phenomenal team, very knowledgeable. Um, so if everyone could go ahead and put your name, your pronouns, your organization or workplace, or if you're an individual, where you live, what area you service, where you're involved in your community in the chat, that'll be a great way for us to get to know each other a little bit. So again, this is me, Raina Granberry. She's her today, Perinatal Equity Initiative Coordinator. I spoke a little bit about what the Perinatal Equity Initiative is, so I will now speak a little bit about AIMM. So AIMM is our African American Infant and Maternal Mortality Initiative. You say that twice, you may get an extra prize. And we all come together. We're a coalition of just a huge collaboration of health department agencies, faith-based folks, birth workers, First Five Los Angeles, community organizations, mental health workers, service providers, doctors, funders, allies, who all came around to really do something about this crisis that has been plaguing our community, not only for the last several decades, but I mean, it definitely has a history that dates all the way back to the enslavement of Black people in the country. So we're all united here under one purpose, and that is to address the unacceptably high rates of Black infant maternal deaths in Los Angeles. And as mentioned, this portion where we're talking about paid family leave, and you all will also in your next session get a little bit of information around earned income tax credit. This is where we are stepping in to do some of the relieving. Lots of Black families have left this money on the table in the past because of a lot of difficulties that will be explained here. So thank you all for coming. Thank our partner, and I'll go ahead and turn it over to California Work and Family Coalition.
Thanks so much, Rena. This has been a wonderful partnership, and we're very excited to start this training today. My name is Charlotte Flanders, and I'm the Education and Training Manager at the California Work and Family Coalition. Jenya, do you want to introduce yourself?
Yeah, good morning. I'm Jenya Cassidy. I'm the Director of the California Work and Family Coalition. Really excited to be here this morning.
And Katie couldn't be with us today. She'll be joining our afternoon trainings, but Katie Water-Smith is the Political Organizing Director for us. Angelica?
Hello, everyone. I'm Angelica Andrade, and I am the Administrative Assistant and Spanish Training Coordinator at the Coalition.
And then Mia.
Hey, everyone. I'm Mia Hemstad. My pronouns are she, her, hers, and I'm the Communications Manager at the Coalition.
Thank you. And Mia made these wonderful, beautiful slides today. And we also have another wonderful organization with us, the Legal Aid at Work. Katie Witchett will be joining us for the afternoon trainings, and she's a staff attorney. But Deanna, if you want to introduce everyone.
Hi there, my name is Diana Fabian Gutierrez, she, her, ella. I am the Work and Family Legal Fellow, part of the Work and Family program here at Legal Aid at Work. And Rachel, do you want to introduce yourself?
Sure. My name is Rachel Langston, and I'm a senior staff attorney at Legal Aid at Work, and excited to be here today.
Great, and I can introduce Legal Aid at Work as our organization. We're a nonprofit legal advocacy organization that has been around for more than 100 years now. Our Work and Family program seeks to protect the employment rights of pregnant women, new parents, workers facing any kind of medical crisis, such as caregivers as well, and help assist you in disability benefits, paid family leave as well. And we do this through legal advice through our toll-free helpline, and we have some clinics available as well. We do represent some people through direct representation, some or limited representation. And of course, we work with our partners for policy advocacy that we'll talk more about later. And we do a lot of public education and outreach. And so we're so happy to be able to join with a great group like this to be informing you all about paid family leave, protections, and everything else that you may have questions on. Thanks.
Thanks, Deanna. So yeah, we are the coalition. Jenya, I think since you're the director, this is fantastic for you to introduce.
Thanks, although, thank you very much, Charlotte. So we're the California Work and Family Coalition, and kind of like AAIMM, we're a different kind of coalition because we came together a while ago, but we're a longstanding coalition. We're a statewide alliance, and we are united in the belief that all people should have the time and resources to care for themselves and each other. And we're a group of organizations and individuals, and we've been really sticking together to make sure that our laws work for everybody. And we'll talk a little bit more about some of the work that we've done. So one of the things that we do is change laws. We came together around the passage of the very first paid family leave law, which we'll be talking about today, and ended up staying together because we found that even though it was giving immense benefits to the people taking it, there were barriers for a lot of people to take it. So we really needed to stick together to make it work for more people. So a lot of what we do is advocating for new laws, but the other big piece of what we do is making our laws work. Part of that is things like this, doing education and outreach, working with our member partners like Legal Aid at Work, Breastfeed LA, a lot of groups that you know in Los Angeles that work with different workers across the state. So we work on the different laws. We also do advocacy to make sure that people know their rights. And part of our strategy is building an ongoing coalition of really diverse partners, because the only way our laws can really work for everybody is if we have a lot of people involved in passing the laws and making sure they work.
Thanks, Jenya. And so our training goals today is to learn about the paid leave laws here in California and across the US, understand the basics of the California paid family leave laws, and understand legal protections under job protection, how to apply. So those are our training goals today. And for our agenda, we're going to start by understanding the landscape here and understand the impacts of the current paid family leave laws, go into paid family leave, understand job protection laws, how to file a claim, and we'll have a Q&A session before we wrap it up and talk about next steps for our next training session. So let's get started. So the history of paid family leave, this has always have been shocking when we present this, but sadly, the US is the only developed nation in the world that does not have a national paid family leave program for its citizens. You can see the title here, 0 weeks. And on the next slide, there was a really great, well, not great, but a very insightful documentary. It is a great documentary, but it kind of shocks you to see the crisis that we have with paid family leave. And we recommend, watching this to really see the impacts. It's called 0 Weeks, and this is a free documentary you can watch online. We have it hyperlinked here, so when we send these slides, you can definitely watch it. But it shows you the current paid leave crisis in the US and also compare it to other developed nations. But as we compare to other developed nations, here is an infographic showing you, well, this is for maternity leave, but also these developed nations have other paid leave laws that support family-friendly, equitable laws. And you see, sadly, the US is at 0, while other developed nations has many weeks supporting new mothers and parents on maternity leave. But through organizing and advocacy, this is changing, as we see here in California. And I'm going to pass this off to Jenya. Jenya has been in this fight for equitable paid leave before 2002 and has been really in the weeds of this.
Yeah, thanks, Charlotte. Yeah, I was like a lot of us who came to this work, and I think, some of you, I was working in a hospital where a lot of nurses, especially CNAs who had to do a lot of lifting of patients, would have trouble with their, paid leave. And I started to learn about just the FMLA and what we had, and then I got involved, and that's how I came to the coalition, because I really wanted, we had rights that people didn't always know about, but we really didn't have enough for what people need when they're having a new child or caring for a family member. So in 2002, we came together to really found the coalition. We thought it would be about a 10-year fight to win paid family leave. And for a lot of different things came together. We have a little booklet on it we can share later, but we passed it in 1 year, which was amazing. And it hit the headlines all over the country. But while we celebrated that huge victory, we also learned as we moved forward that, people started taking paid leave in 2004, and around 2005, 2006, when we started getting more kind of information about who was taking paid leave and who wasn't, we really found that it was hugely benefiting people. The rates of breastfeeding were going up. More dads were taking leave. People felt more economically secure when they had a baby than they did for their first child, maybe, that they had before paid leave. So these benefits were amazing, but they weren't hitting everybody the same way. Not everybody was feeling them in their lives. So a lot of what we kept doing as a coalition is, how do we really make this work more for more people? So with our partners like Legal Aid at Work, Breastfeed LA, unions, the Black Workers Center, a lot of different immigrant rights groups, we all came together to keep pushing for more. And we expanded in 2013. People could take paid family leave for more family members, because a lot of people care for a grandparent or a sibling, not always just a spouse or a child. In 2016, we increased the wage replacement from what it was, 55% to 60% or 70% for low-income workers, and that was a big victory. Jerry Brown signed that. There was another big celebration. And then in 2018, we passed the New Parent Leave Act, so more parents could take bonding leave. And one of the really biggest victories, that it might seem strange how long it took and how hard it was last year expanding job protection to 6 million people and expanding the family definition. Both Coalition and Legal Aid at Work will be talking about this more and what this means. But before, people could literally be fired for taking paid leave, even though they're paying into it. And we'll talk about that as this training moves forward, and how that's changed. So one of the things that is really important about our win in California is that when that happened, it really sparked a movement around the country. And we are now part of Family Values at Work, which is a network of, I think it's over 30 states right now that have similar coalitions to ours and are really fighting the same fight to get paid leave in their state. And the strategy all along was, if enough states have it, we can create a tipping point so that there will be a federal law. And this year, we really look like we're closer than ever before, because there's been such momentum. So as you can see on this timeline, we started in 2002, that was California, and look how long it took for another state to get it. And then another state, still many years later, New Jersey, Rhode Island, were our sister states that won paid leave. And then you're starting to see a cluster. And what we're really hoping for is, while we work to expand these rights in our states, that we're also able to win a national law, because we need our family members that are all over the country. We really need a national law like other countries.
Okay, this is my section, I think, right, Charlotte?
Yes.
Great. Just want to double check and make sure. And I just want to say that to highlight what Jenya just said, because there were some people who were messaging me on social media saying, wait, I thought we had some weeks of leave. Why are we saying there's 0 weeks? And so I want to be clear, if you're new to like the language of advocacy and just like national versus federal, basically what it means is, like as Jenya said, nationally, we don't have a law that covers everyone, right? But we do have some leave here in California. And so I just want to be clear, because I've been told that can be confusing for some people, that as you saw in that timeline, there's about 10 states that have some sort of program, but then that leaves about 40 other states, right, with nothing. So, we're talking about the national. Anyway, let's go ahead and dive into the years of studies that show what paid family leave can do. But before I go into the details, I just want to say, hey again, my name is Mia, and I am a mom of 2 little kids, and I am Just so grateful to be here with all of you, because as a Black mother myself, when I was having my babies, I did not know about my rights at all. So it just brings me so much joy to be here passing along this information and empowering all of you with this information. So paid family leave does a lot of really good things for community health, for public health. It lowers infant deaths. It increases the number of babies attending their well baby visits and getting their vaccinations, increases the number of people who breastfeed. It extends the amount of time that people breastfeed, which we know helps lower rates of infection and sudden infant death syndrome. It enables parents to be home with their baby during the most critical time in a baby's life. And I would also say in the parent's life as well during that transition. A baby's first 12 weeks are critical for brain development, and it shapes the way a child interacts with their surrounding for their entire life. So we know that it's just scientifically backed that paid family leave is so important for health and that transition. So as you see in this infographic here, when New Jersey passed paid family leave, mothers who took it under the state program, they breastfed for 1 month longer on average. And in California, parents who took it, the breastfeeding doubled. The average median duration of breastfeeding doubled among new moms who took the leave. The increase was about 5 to 9 weeks in lower paying jobs and 5 to 11 weeks in higher paying jobs. So again, we know that one of the amazing benefits is that it enables mothers and chest feeding parents to breastfeed and chest feed longer, which we know has so many incredible benefits for the parent and the child. So some more great things about paid family leave and paid sick days. They allow people caring for a family member to remain in the workforce, right? You know, have a crisis, a medical crisis happens in your family. A lot of people have to quit their jobs sometimes and deal with a major financial hit and go into debt. By having a paid family leave infrastructure, you're able to take time off that's paid, partially paid, so that you can take that time off without having to leave the workforce altogether. Another benefit is that it improves people's economic independence, which helps prevent intimate partner violence and also helps you to not be so chronically stressed, right? Which is a huge health benefit in itself. They also improve employee productivity and retention in the workplace, which is good for businesses. And it's one of the reasons why we keep advocating that this is good for the whole community and the economy and workers. And it also helps to close the pay gap between men and women, because as we know, caregiving responsibilities often fall to us. And that usually means that we're taking the pay cut, we're taking the part-time job, we're taking the promotion hit because we can't afford to stay in the workforce and also take care of our loved ones who are sick or need our support. So this helps to bridge that pay gap. Another thing that it does is it increases the number of people receiving preventative care, which lowers long-term healthcare costs. I mean, how many of us have postponed that doctor appointment that we know we need because the idea of having to leave work and not get paid for that time is so stressful that we put off our own healthcare, which we know, us as moms, it's like we're always making sure our kids get to the doctor, but we forget about ourselves. But we have to remember that our health is connected. It's connected to our kids, it's connected to our families, and it's important. So paid sick days is another benefit that offers us that ability to take temporary time off to go to the doctor and not have to worry about pay. Okay, so here are some disparities that we're going to go into, and just take a deep breath, because some of these statistics can be angering and triggering, but we want to bring them up because at least for me personally and other Black women I have talked to, we internalize a lot of shame around the struggles and the disadvantages that we face, thinking that if we just tried harder or if we planned our pregnancies better or whatever, that maybe we wouldn't be in such a stressful situation. But the fact of the matter is that the stressors and the struggles and the racism that we experience as mothers, as Black people, is not our fault. So it is not just you. Systemic inequality and racism is at the root of the challenges that Black people face. I know we all know this, but I feel like it wasn't until really recently that we've all really been able to talk about this publicly. So we wanted to take some time today to acknowledge this with a few statistics to back this up. So as you heard earlier from Raina, Black infants continue to die at more than 3 times the rate of white and Asian infants. And again, that number is higher in other areas, like in Texas, for instance. Black women are 3 to 4 times more likely to experience a pregnancy-related death than white women. Compared to white women, Black women are more likely to be uninsured, face greater financial barriers to care when they need it, and are less likely to access prenatal care. Black women experience higher rates of many preventable diseases and chronic health conditions, including diabetes, hypertension, and cardiovascular disease. When or if Black women choose to become pregnant, these health conditions influence both maternal and infant health outcomes. And all of this data is from the National Partnership for Women and Families. There's so much more data, but this is what we're going to keep it at for today, and just inhale and exhale, because it can be very frustrating, and we hope to start to, combat this systemic inequality through empowering y'all to know your rights and to also advocate for better rights that don't leave people out. Okay, so a question for you. Did you take paid family leave? You can go ahead and put this in the chat if you feel so compelled. You don't have to share if you don't want. How did it impact your pregnancy and your parenthood experience? If you did not take paid family leave or know about it, how do you think it would have changed your pregnancy and parenthood experience? So go ahead and take a minute to jot down in the chat, like, did you take it? Did it help you? Did you not? For me personally, I did take paid family leave with my first birth. But the problem was I wasn't aware of my rights. So I thought that my maternity leave was a kindness given to me from my employer. And even though I was grateful to have the time off, I thought it was something that was given to me that could be taken away from me at any time. So during that maternity leave, I was stressing out because I wasn't sure if I was going to get a phone call that I lost my job, or if I was going to phone call that I needed to drop my kid in childcare earlier than I anticipated to come back to work. And that's one of the things that's so important about knowing your rights, is that it gives you that peace of mind that you know that this leave that you're taking, you are entitled to. No one is giving it to you. It is not a handout. You are entitled to it. And that's why it's so important for you to know your rights as a worker and what you are entitled to. I wonder if we're going to take a minute to shout out some things in the chat. Charlotte, can you do that? Because I can't really see the chat.
Yes, I was about
here we
to.
go.
Yeah.
Okay, now I can see the chat. Sorry.
Okay.
It's hard when you're sharing your screen. It's like, where did the button go? Okay. Danae said, I did not take it, but I feel as if I knew more about it or was just aware about everything, it would have definitely been a less stressful environment. Yes, exactly. Marissa says, I am 37 weeks with my second yesterday. Congratulations. And I'm here to learn more to advocate for more parents. Thank you. We need you. Rosalba says, it was very stressful. It was my second pregnancy here in the States. Yes, exactly. Reina said, like others, I took it and my job gave me a hard time about it. Yes, that's another factor we have to deal with. Mercedes says, yes, I did take it. It helped me bond with my babies, but the jobs did threaten me. Yes, exactly. Okay, so many good comments coming in, experiences, and we're going to be saving this chat because we do think that, we're going to read it. We want to know what the community is going through. We want to know what you all are going through. And so just know that we really appreciate every single share here. Okay. Yes, amazing. And that's why we're going to talk about job protection later, because again, peace of mind, right? You should know, oh, you might not like that I'm taking paid family leave, but I've been here for a year and I've worked my time and I am protected by job protection laws. So that's another thing we're going to talk about later, so that you can have that peace of mind. Even though the discrimination might still happen and it's still frustrating, at least you could have that kind of, you can be empowered to know that they can't do anything about it. They can't fire you. So let's just talk about the barriers to paid leave. So there's a lack of awareness, like we saw in the chat, especially among BIPOC, Black people, people of color, Indigenous people. There's a low take-up among new immigrants and monolingual Spanish speakers, again, due to that lack of awareness. The application process is super difficult to navigate. Wage replacement is not enough for low-wage workers, which we're going to talk a little bit more about later and talk to you about how you can help increase that wage replacement rate. There's a limited definition of family, which impacts queer and immigrant communities, right? I mean, up until last year, you weren't able to have job protection if you were taking leave for a sibling. Until we passed the law last year. So that affected me negatively because I was a caregiver for my brother for a long time, but he wasn't considered eligible under job protection. Again, lack of job protection. We did increase the job protection. It's amazing. Still doesn't cover everybody though. It's difficult for independent contractors to access these benefits. Most public employees are not included. Fathers are less likely to take leave for bonding their mothers because of stigma. And people who need to care for a seriously ill family member don't realize that they can take paid family leave because they think, oh, it's just if I have a kid, or if it's only if I'm sick. They don't realize that if someone else is sick, they can take that job protected leave, depending. We'll go into the requirements later, but again, there's a lack of awareness there. And here's a really great infographic that just kind of reiterates the point. You can see here that with awareness of PFL, that people of color are less aware of it, with the Latinx community being the least aware. By education, if the higher your education level, the more likely you are to be aware of it. And again, income level, the less money you make, the less likely you are to be aware of it, which again is ridiculous. You know, so many of us, we pay into this right, which I'll talk about soon, and we should know about it so that we can take advantage of it and use this right. Okay, so let's get into what is paid family leave. Okay, and if you feels like it's going over your head, it's because it is complex. Like, we at the coalition, we acknowledge this is complex, and we are working every single day to try to make these laws easier and simpler. So no, if you don't get it all, we're always here for questions. And if you want to clarify something, we are here. You don't have to memorize it all today. So paid family leave and disability insurance. So the reason why I'm adding in disability insurance is because they are really two parts of the same whole. But just oftentimes we talk about paid family leave when we're talking about bonding with a new child, but we really want to also emphasize that paid family leave and disability insurance are two parts of the same whole. And disability insurance is something that a pregnant person would take. I think it's up to 4 weeks before you actually give birth. So we're going to talk about both here. So paid family leave and disability insurance are both wage replacement programs, meaning when you aren't at work and making money because you're going to work, you're getting money from somewhere else so that you can continue paying your bills and feeding your family. These programs are funded by the California State Disability Insurance Fund, which is funded through your taxes. Most employees, most Californians are paying into this. So this is your money that you have access to when you have to take leave. And there's different types of leave that you can take. So if you can't work because you are pregnant, you have a pregnancy-related disability, or you have a serious illness or a disability that you're dealing with yourself, you would take disability, you would file a disability insurance claim. You would take what's called disability leave, but it's all from the same money pot, if that makes sense. If you are taking leave because you want to care for a sick family member or you want to bond with a new child, you would also apply from the same pot of money, the California State Disability Insurance Fund, but it would be under a paid family leave claim. And it's like, I don't want to muddy the waters here, but this is important because when you get to the application section, which Charlotte will cover later, you're going to be either filing a paid family leave claim or a disability insurance claim. And I would hate for, applying to be the first place that you see DI. You see it on the website, it'll be like DI claim or PFL claim. So I want you to know here, they're like the same thing because it's money coming from the same place as you can see in this visual here. California State Disability Insurance. It's your taxes funding this pot of money that you draw from if you have a pregnancy-related disability, if you have a disability or illness yourself, if you're caring for a family member, or bonding with a child. And here is just a visual here. If you're sick, disability insurance is what you access. If you have a pregnancy-related sickness, disability, disability insurance. If you're caring for a sick family member, paid family leave. If you're bonding with a new child, paid family leave. And again, all comes from California State Disability Insurance, CEDDI. And it's what you pay into with every paycheck. So as you can see here, one of the eligibility requirements for paid family leave and disability insurance is paying that tax, that CEDDI tax. So if you look at this image here of the pay stub, you can look at the tax section on your paycheck, which I know a lot of us don't look at the tax section. We don't want to look at the tax section. But if you look, you see, oh, I'm eligible for this because I'm paying into California State Disability Insurance. And that means I'm paying into that pot of money that I can draw from when I need to take leave. So again, reiterating here, an eligibility requirement is you have to take time off work because you have a new child or you need to care for a seriously ill family member. Falls under paid family leave. Another eligibility requirement is you would file for a disability insurance claim and take what's called disability leave if you have a pregnancy-related disability or you need to care for your own illness or disability. And another eligibility requirement is that you would have earned at least $300 from which that tax, that California State Disability Insurance tax was deducted from your base period. If that sounds a little bit complicated, don't worry, you're not alone. I had to go over this at least 5 times to fully understand, but all it means is that you're paying into this fund, you've made enough money where you've been taxed enough to pay into the fund, and you have a qualifying event. You're pregnant, you're sick, someone else is sick, or someone else needs care from you, or you have to bond with a new child. So here are some more eligibility requirements, similar, but a little bit more like additional. You're unable to do the work, which is just another way of saying you can't work because you have a disability, you're pregnant, or you need to care for someone else, or you need to bond with someone else. You must be in the labor market, meaning that you're still actively looking for a job or that you do plan to return to work. You must have suffered some sort of wage loss. And again, you must have earned at least $300 from which state disability insurance deductions were withheld during the base period. Another thing we want to note is that citizenship and immigration status do not affect the eligibility of paid family leave benefits. So we get this question a lot. We're like, I'm an immigrant. Do I qualify for this? Yes, you do, because as long as you meet those requirements of having that qualifying event and having made $300 and paying into the fund, you are eligible. However, I want to say that the claim form requires or asks for a social security number. And if you don't have a social security number and you leave it blank, the way the EDD system is currently set up, they go, oh, this claim form wasn't complete, send it back, reject it. And that is actually something we are actively working on with the EDD, that they need to have clearer instructions for people whose immigration status is still, pending. And so they're aware of that. That's something we're working on. But I do want to say that if you need to file a claim and you don't have a social security number, that you can reach out to one of our lawyers at Legal Aid at Work. You can reach out to us at the coalition and we can walk you through what to do with that. Sometimes I think it's like the process is go get on the phone with them and what have you, but we're here to help you with that. All right, so paid family leave for bonding. So you can take paid family leave again to bond with a new child or to care for a seriously ill family member. So let's talk about bonding. This program provides partial pay for parents while they are on leave from work to bond and care for a newborn, an adopted child, or a foster child within the first year after birth or placement. You will get 60% or 70% if you're in that lower income bracket. I don't know the exact number off the top of my head, but again, we can help you with that. Or the EDD evaluates it and then they let you know if you get 60 or 70% of your normal weekly wages, up to $1,357 per week for up to 8 weeks. So you can qualify for up to 8 weeks of this paid leave. I want to call out and flag here for all of you. This rate, the 60% of your income or 70%, it will potentially go down this year. It will go back to 55% by December 31st, 2021, because the increase was a temporary policy that was implemented for us to go, okay, was this used? Was this needed? And of course it was used and it was needed. And so this year we are advocating not only for us to keep it from going down, but to increase to 90%. And we can email all of you after this training more info about how you can get involved in making sure this rate doesn't go down, right? Because when we have a child or if we are caring for a sick family member, our expenses go up, not down. So we don't want this to go back down. And one of the ways we can make sure that happens is by advocating, calling our legislators and saying, hey, please make sure you vote for this to increase. Do not let this go down. And we'll email you more details about that later. So paid family leave for bonding can be taken all at once or in parts. So hourly, daily, weekly. I know some folks that do 2 weeks after the birth, and then later on, they might do 4 weeks later, et cetera, et cetera. You can decide how you break that up. And you would apply through the Employment Development Department, also known as the EDD, within 41 days of the event or later with good cause. So the bonding application. The application will require proof of relationship for birth parents, non-birth parents, foster and adoptive parents. If the birth parent used pregnancy disability leave, they do not have to provide further proof of relationship. And what that means is, as the birth parent, if you took leave maybe 4 weeks before you actually gave birth under pregnancy disability leave, you don't have to submit, oh, I'm actually the mom of this child that I'm now taking bonding leave for, right? Because they already have that on file. If a parent did not take pregnancy disability leave, they will have to provide proof of relationship like a birth certificate. So say like your husband, didn't have to take pregnancy disability leave, isn't the one giving birth, but he is now needing to file the bonding application. So he would need to submit that birth certificate to say, I am indeed the father of this child. Paid family leave for caregiving, really important. So this provides partial wage replacement to take time off to care for a seriously ill family member, defined as children, spouses, domestic partners, parents, grandparents, grandchildren, parent-in-law, and siblings. So these are all the different family members that you can take caregiving leave for, and we are currently working on legislation this year to expand that definition of family to chosen family, so that folks who don't live near blood relatives or maybe don't rely on their blood relatives for care can take leave. So again, we will tell you more about that amazing bill we're working on later on. This leave, again, same thing as the other one, 60 or 70% of normal weekly wages up to $1,357 a week for up to 8 weeks. The leave can be taken all at once or in parts. And again, you can apply through the EDD website within 41 days of the event or later with good cause. The caregiving application, some things to note. The application will require a medical certification, the care recipient's authorization for disclosure of personal health information, and a statement of care recipient. This is a whole lot of words that basically just means you have to prove to the EDD that the person you're caring for is actually sick. And you get that information from a doctor or a healthcare professional. So you would need also a certification from a physician or medical practitioner to verify that the person you're caring for is sick. And then you would need to fill out a form that's provided by the EDD, which is, again, the application requires that care recipient authorization. And then you can care for a family member in another state or even another country. The care doesn't have to occur in California. Okay, so Charlotte, how are we doing on time? Because I know if we don't have a ton of time, we can skip through these full questions. We want to actually make it through this presentation.
Yeah, so we're actually good on time. We have 3 more minutes before we transition to job protection. So I think we can definitely do the poll questions.
Awesome. Okay, poll question 1. This is just to like solidify the knowledge we just went over. We covered a lot. So Jordan and her partner Alicia just had a baby. Jordan is a public employee and wants to take time off to bond. Jordan looked at her paycheck and California State Disability Insurance is not taken out of her paycheck. Does she qualify for paid family leave? Yes, no, I don't know. Don't be shy. Go ahead and test your knowledge out with the polls. Okay, some responses are coming in. Most people are saying no. The answer is no. Okay, let me X that out. Okay, so no, because Jordan does not pay into California State Disability Insurance. Public employees aren't required to pay into it, so therefore they are excluded from the benefit. Poll question 2. Kristen's father has cancer and he needs her help to attend doctor's appointments, give him meds, take him to help him to receive treatment. Her father lives in New York. Can Kristen still take paid family leave if her father lives outside of California? Go ahead and jump in. What do you think? Yes, no, I don't know. So we got a lot of yeses, a few no's, 1 I don't know, no problem. The answer is yes, Kristen can take paid family leave because as long as she's the one paying into the California State Disability Insurance Fund, right, that employee tax, she can take leave even if it's out of the country or in another state. So really important recap, paid family leave is a wage replacement program only. It does not require your employer to give you your job back when you return from leave. So you want to make sure you're not only eligible for paid family leave, you want to check if you're eligible for job protection as well so that you don't risk getting fired or losing your job when you're on leave or for taking leave. All right, now I'm going to go ahead and pass it over to Legal Aid at Work to cover job protection.
Hi, everyone. My name is Diana Fabian from Legal Aid at Work. I'm a legal fellow here, and I'll talk about job protection. So, of course, we have different laws that provide the pay during your pregnancy leave or caregiving leave, and the job protection is different. So your employer must guarantee you your job or a comparable job when you return from leave and maintain your benefits during that leave as well. Refusing your request for leave or retaliating against you is prohibited by law. So we definitely don't want anything like that to happen, and you're always feel free to contact us at our hotline if something like that does happen. We want to be there for you every step of the way and make sure that your employer isn't discriminating against you for taking this time off. But your employer is only required to protect you for your job if you're covered by certain separate state and federal laws. And so we'll go to the next slide. There's 3 different job protection laws. The federal one is called the Family Medical Leave Act. And so this one is the national one that most of the employers know about. If you have a national organization or offices that operate throughout the country, they'll probably refer it as FMLA. But here in California, we have a more encompassing law called the California Family Rights Act. So this is the one that we're going to be referring to. And usually employers might call it FMLA time, but it's really the California Family Rights Act time that we're taking because they run concurrently. And then lastly, for anyone who's pregnant and is disabled due to their pregnancy, we have pregnancy disability leave, which we'll be talking about more. Okay, so pregnancy disability leave gives you up to 4 months of job protected time off while you're disabled due to your pregnancy, childbirth, or any other related condition. So although this leave is available for 4 months, it does not mean that you get it for 4 months. And it also is only during your disability period. So you can't save the 4 months for before or after, which people tend to think about, but it's so long as a physician or your care provider will certify that you're disabled due to your pregnancy or other related condition. And to qualify for this leave, it's an easy threshold of at least 5 employees. And so no other time requirements or if you've been there for so many hours, so long as there's 5 employees, you're eligible for pregnancy disability leave. This can be used for prenatal care. So any time off you need for appointments, you can also request to use some of your pregnancy disability leave then. And this is when it says it can be used intermittently, so in parts. So if you have a standing appointment every 2 weeks, go ahead and ask your employer just a little bit ahead of time to take your pregnancy leave for those days. They must continue your health benefits during this time as well. So they can't stop your health benefits just because you go on to pregnancy disability leave. So usually this leave will be about 4 weeks before your due date or your estimated due date. And then for a vaginal delivery, it'll go 6 weeks after your birth or 8 weeks for a cesarean after your birth. And these are just estimates. Sometimes they cover more if you have a provider that thinks that you can't return in those 8 weeks, or if you're still disabled due to your pregnancy. We've seen a lot of people who are out a little bit earlier just because of COVID and they might be a little bit high risk. They might use some time before that and the doctor might think it's not safe to be out in your workplace during that time. So once again, like I said, this time cannot be saved up. I do recommend that parents who are pregnant should take those 4 weeks before prior if they are eligible for that. And we'll go to the next slide. We're so excited to announce, Janya previewed this a little bit, that last year, the California Family Rights Act got expanded a little bit. So this was SB 1383. This was a major effort where we worked with the coalition, with all our team members to expand these family-friendly policies. And so we'll talk a little bit more about that family definition, as well as the threshold for California Family Rights Act in a little bit. So to be eligible for the California Family Rights Act, you must be 1 year on the job. You must have worked 1,250 hours in the year prior to you taking your leave. So this is about 25 hours a week. And just because some people have been, maybe their offices have been closed to COVID, they are counting that time off as well in the last year. So make sure you take into consideration any other time you may have taken off, or even if your offices have been closed. And then finally, you must work with an employer with 5 or more employees worldwide. So if that means that you're the only one working in California and you have some company mates in Asia or Europe, that you still are eligible for the California Family Rights Act through your employer. So this threshold was lowered from 50 that was required before. So it's helping 6 more million Californians to access that job protected time off that they so desperately need for paid family leave. We'll go next slide. And I'll actually have Rachel pick up from here to talk more about the California Family Rights Act.
Thanks, Diana. So the California Family Rights Act is, again, as Diana just said, it provides protections, job protection, meaning your employer cannot fire you or demote you or anything like that, as long as you have 5 or more employees in your workplace. This is separate and in addition to pregnancy disability leave. Next slide, please. So what CFRA, so not only, well, let me back up a little bit. So we've talked about paid family leave, and just as paid family leave gets you some wage replacement while you're on leave to bond with your new baby, but it doesn't necessarily protect your job. So we've, frequently got calls from people who, say I'm on SDI, state disability insurance, right? I got approved for paid family leave and my employer's threatening to terminate me. And I always ask, well, have you requested leave under the California Family Rights Act, or are you eligible? Because that is what saves your job for you. So you got the wage replacement on one end and then the job protection on the other. So that's important to understand. The same bill 1383 that Diana talked about also expanded who CFRA applies to. So we'll talk more about how you can use it for bonding with a new child within the first year of that child's time in your home. Often that's the first year of a baby's life, but if you are fostering a child or adopted a child who is older, it's the first year of their time in your home. But it also applies when you're wanting to provide care for a family member with a disability or with a serious health condition, rather. So you can now, after 1383, take time off to care for children, adult children over 18, spouses, domestic partners, parents, grandparents, grandchildren, and siblings. So a lot of folks. So that is really helpful. It also extends job protection to military families. So if you're a family member of someone in the military, you can take time off work and use your paid family leave and have job protection under the CFRA to provide or arrange childcare, get parental care, make legal arrangements. So that's another benefit to this. Okay, so I talked a little bit about this, but you do get 12 weeks per year of job protected time off. It can be taken all at once or intermittently, meaning you could take it, say you have to take your child to a weekly doctor's appointment for an hour a week. You can use 1 hour of that 12 weeks per week, and it could last you quite a long time. The one difference is if you're bonding with a new child, generally you have to take that bonding leave in at least 2-week chunks, with 3 exceptions where you can take it for shorter periods. Then your employer has to return you to the same or an equivalent job as that you were in when you took the leave. They again have to continue your health benefits, as whatever they cover as far as your health benefits. So if they cover a part of the premium, you still have to cover what you would normally cover while you were working, but they continue their part of the coverage while you're on this leave. And also you're protected from discrimination and retaliation for taking this leave. So if you don't qualify for job protection, Again, that doesn't mean you can't get the wage replacement. As I said, they're separate things, and having both is good. So you can still use your paid family leave as long as you pay into state disability insurance. You can ask your employer to hold your job while you're on leave, but your employer is not legally obligated to do that. Multiple steps to ensure your rights. So definitely talk to your doctor or medical provider, because they have to provide, if your employer requests one, a certification. And so this is more if you are taking leave for your own serious health condition, which again, you can do under the SIP. You should also talk to your employer, talk to the Employment Development Department, because they are the agency that handles not only unemployment insurance, but also applications and payments for state disability insurance and paid family leave. And definitely the lawyer in me has to emphasize, document your communication. Get everything in writing so that there's a record, because if someone misses a step or says you never talked to them or any of that, you'll have proof that demonstrates otherwise. And then one other quick thing. Well, I'll do these poll questions, and I may have another quick comment after.
Rachel,
Oh,
if you
I'm
don't
sorry.
mind me, so I think we'll skip over the polls because we're
okay.
running in time. We'll do these poll questions at the next training. For y'all, it's just going over what we just learned that Rachel and Deanna said. But Rachel, I wanted to let you say what you wanted to note before we go into how to file a claim.
Sorry, just a moment here. I actually, I will hold off on that. And actually, I think pass it back to Deanna, I believe.
Alrighty, so yeah, we'll go back to those polls. It's really just like how we did for PFL, just like, testing your knowledge and making sure you understand. But we're going to review next training as well, everything that we just learned, and we'll do that in the next one. So I wanted to go into how to file a claim, PFL claim. We're not going to go in depth about this. This is just going to be a quick synopsis and an overview. We will provide resources that provide videos, a step-by-step guide on how to apply, but I did want to just go over this. And like Mia, Rachel, and Deanna have said before, if you need help on anything, please contact us at any time. So the first step is to apply on the EDD website. You have to complete a one-time registration to create a benefits account. You'll create a claimant profile. So on the next slide, so after you create that claimant profile, you'll have a benefits account, and you can choose UI, so the unemployment insurance, or SDI, kind of like Mia highlighted. So when you go in there, you won't be confused, like what are all these different terms? So you'll look for SDI, so state disability insurance. And in state disability insurance, as you can see here, there's various benefits to apply to. You can apply to disability insurance, so for your whether you're disabled by condition or pregnancy related condition, and also for paid family leave benefits. And in this profile, you can see you can file for a new claim. You can always save your claim, so you don't have to complete it all in one sitting. You can take your time doing this, keep track of your documents and any pending actions. On the next slide, we want to highlight that you can file for both disability insurance claims and also for PFL claims. You can file online or by mail. One thing I do want to note is that for new mothers transitioning from pregnancy-related disability insurance to a PFL claim, you will automatically receive that claim for PFL into your account. As you're ending your disability insurance, it will pop up there suggesting to apply for this. And again, this will come to you online or mail, depending on how you wish to file that. But for the mothers who did not take disability insurance, or fathers, partners, foster adoptive parents, you would just file a regular bonding claim. Another thing we want to know, and Mia, oh, Mia, if you could go back, please. That Mia highlighted on this is that we do recommend for undocumented individuals that you apply by paper. There's a little less complication and barriers regarding social security number. Rather, you can attach wage documents. Rachel, I didn't know if you wanted to add a bit more to that, but this is something we just want to highlight because this has been some issues that have been brought up to us.
Sure, I'll just say the latest that we have is that's right. You would fill out the paper application. You would leave the someone who's undocumented, you leave the social security number blank, and then as Charlotte said, you would attach you know, a W-2 or a paycheck. Then what will happen, we've learned, or the kind of new procedure for the EDD is they will then call the applicant information in order to confirm their identity or what have you. But right now, paper is the way to go because you can't really skip the social online. Also, we are developing kind of a guide on this process. Legal Aid at Work it's not yet available, but hopefully will be very soon on our website.
Thanks, Rachel. Yeah, so again, online or mail, but we do recommend for undocumented folks to apply by mail because like Mia said, you pay into this, this is your right, and we do want you to access this. So on the next slide, for the claim, so for each claim, it's going to be either 4 to 6 step process, depending what claim you're applying to. Some required information, like Rachel said, is your social security, your California driver's license, your most current employer's information. For those applying to bonding, it's going to ask you for your child's birthday and your employer's information, when you want to file your PFL claim, the day you want to start, and how long you want to take it. And on the next slide, as I was saying, that it's going to ask you for bonding your, baby's birth date, gender, name. If you are the non-birthing parent, that's going to ask you for your relationship with the child. For the care recipient, for caregiving, it's going to ask you about the care recipient's name, birth date, relationship, and address. And then on the next slide, as you are wrapping up your claim, it's going to ask you if you want an EDD debit card or a check. And as you see here, please save that receipt number that you will need for future reference. For both bonding and caregiving, you will have to provide a proof of relationship, and this receipt number is really going to be important. And in case there are any hiccups or anything you need, this receipt number is going to be an important reference for you if you're contacting the EDD. Most claims are processed and a decision is made within 14 days from the date that the claim was submitted. On the next slide. So after you submit that, after you submit your claim, you will have to provide a proof of relationship within 10 days from the date that you submit your online claim. So you would go back to, again, your SDI claimant account, and you would submit the electronic PFL bonding attachment or submit a care leave attachment, whatever you need to, and then you will find your receipt number there and submit that proof of relationship on your benefits account. So, and I think that's the last one, right? Oh, so if you could go back, Mia, real quick. And I just want to highlight that. So this was a very quick overview of how to apply. We will be providing resources that go a lot more in depth, that will provide you really the step-by-step process, whether it's DI, PFL, or whatever you need. And there will also be step-by-step videos that will provide this in English and in Spanish. So we'll provide those hyperlinks at the end. And like we said, please contact us for anything. And then I think, now we can go into some questions. So Yeah, if anyone has questions about anything we just covered, we're more than happy to take questions now. You can go ahead and put questions in the chat, or you can unmute yourself and ask questions right away.
Hi. With regards to filing, when you're actually filing an application on behalf of a client, we would be supporting the process of setting up the profile for them. What are some of the best practices? Would you recommend filing on paper on their behalf versus online? And would we set up the account, or would the account be set up with their information?
Yeah, Rachel, I didn't know if you wanted to cover that.
Sure. So if you can file online, so if you're not in the situation of being undocumented, we recommend filing online because it's generally faster and it's easy to sort of log in and get information and send messages and things like that. So that's what we would recommend. You can, I would say, certainly help a client set up a profile. It does give, I believe, a password so that they can log in later. And also, if you do it online, they actually, either way, I think the doctor can complete their certification online as well. So that would be my general recommendation.
Did that answer your question well? Is that a...
Yes, thank you.
Okay, great. So we have a question in the chat. Clarification, undocumented workers use the paper application because the online form doesn't allow you to skip the social security number. And with the paper application, they can mail in checks and copies. Yes, that is correct, right, Rachel?
Yeah, I mean, I don't know about the driver's license necessarily. I mean, that they may ask for that, but check stubs and like W-2s and things like that.
Another question is I have been in my job for more than 9 months, but I have just checked my CA/SCI taxes and it shows on less than 300. Would I still be eligible for pregnancy DI?
You want me to take that one as well?
Yeah, if you don't.
Sure. So yes, most likely. What you have to have done, you have to have at least earned $300 from which taxes were taken. So you don't have to have paid $300 in taxes to SDI. So as long as you earned $300 in one of those quarters, so not counting the current quarter, but looking back at the previous quarters you worked, as long as you've earned $300 and those had SDI taxes taken out, you should be fine.
Okay, another question. I was placed on work disability on January 27, 2021, prior to the start of my maternity leave last week on March 3rd, March 28th, 2021. Do I need to start another claim for pregnancy as well?
This might be a little specific, so it may be something you want to call us about. I would say if your disability was for, which it sounds like, a non-pregnancy related reason, and you're no longer on that disability, then yes, you would need to do that. But if you're still on disability, then and you would remain on it during your pregnancy anyway, then I don't know that that's necessary. But once you're no longer disabled, you could, assuming you meet the eligibility requirements, you would do a separate application for paid family leave if you wanted it, again, after you were no longer disabled.
Yes, and like Rachel suggested, if you need more specific and personal advice, we will provide all contact information for the coalition and Legal Aid at Work, and they have a hotline to help anyone And another question, will the resources and tools you share also include materials to help support undocumented people apply for benefits? So like Rachel said, they're creating a guide, and we don't have resources just yet. The issue regarding Social Security number and undocumented individuals applying has been something that we've been kind of tackling for the past few months and haven't created a guide yet. But once we do, and once Legal Aid at Work does, we are more than happy to share that. What we do advise is that, please call us depending on your unique situation, and we're happy to help, guide you into the best possible way to make sure undocumented individuals access their benefits. Does anyone have any other questions? Don't be shy.
I have a question. Hey, it's Jenya. I was thinking that maybe Rachel or Deanna could talk a little bit about kind of an interesting thing that I think comes up a lot, whereby, let's say you were working a job before. So I was just thinking about the question about how much you pay into SDI, right? Well, you paid in enough, but let's say you literally just started your job. That can put you in a different category for the job protection. But I was wondering if Rachel or Deanna could speak to the fact that if you had a prior job where you were paying into SDI, that makes a difference in your current job, even though it doesn't for the job protection piece. That could be if you went from a private job to public employee, or even just were unemployed. So Rachel or Deanna, could you speak to the unemployment issue?
I'm happy to speak to that. So yeah, as long it's not tied to the money you've earned at your current job, whether you're eligible or not. What the EDD, Employment Development Department, does is looks back at your base period, which, as I kind of highlighted earlier, doesn't include the current quarter, but they look at the 4 quarters prior to that and base your benefits off your highest earning quarter. So those earning quarters could be for another job, etc. Similarly, if you are unemployed at the time when you need to, take get state disability insurance or paid family leave, you can do that as long as you're able and available to work. Usually, someone might be on unemployment at that time. So you can switch to state disability insurance and paid family leave, which tend to be a little bit more money, and it's not taxed since you've already paid taxes on it. So you would just contact the EDD and fill out the paperwork and make sure you're not receiving both unemployment and one of the other two. You can't be receiving them at the same time. But yeah, so even if you're unemployed, but you were previously employed in the last 4 quarters and earned the $300, you can still apply even at that point. So it's definitely not tied to a specific job.
And I have a good example of it, Rachel, if I can interject, of this exactly happening. We had a caller who worked as a gardener before the pandemic, and he was working, let's say, stopped working in March 2020. He was on unemployment, and he'd worked for the company for 4 years. And they returned to gardening in about November, but when his employer returned him to his position, they hired everyone back as independent contractors and not as employees. So that's an issue in itself. But when he wanted to take paid family leave for his newborn son in February, he said, am I eligible for the paid family leave? And so we took a look at his base period, like Rachel said, and he still had put enough taxes from when he was qualified as an employee prior to the unemployment and prior to being an independent contractor. So even though you haven't been an employee for maybe a year and you want to try to take it, definitely take a look, and we can help you assess things like that. Or if you have clients, we can definitely refer to them and talk about these situations, because I know we hear a lot from the the mothers, but we also want to hear that fathers are able to take their paid family leave and may be eligible because it has a lot of benefits to the newborns.
That was great. Thanks, Jenya, for that question, and Rachel and Deanna. If no one else has any questions, I thought we could, oh, yes, go on.
Yes, actually, thank you. Just hearing Diana kind of made me think about another scenario. Wanted to ask if the same kind of situation could be applied to someone who was working in California, but then relocated to a different state. But those, similar kind of rules, could they look back and use their employment to apply for benefits in California?
I'm going to let Deanna or Rachel take that one.
I'll let Rachel go.
Okay. Yeah, and I would actually need to double check that. If they're permanently living in another state, I don't think they'd be eligible. If they, lived in California, worked for another job, out of state, and then came back to California, they could still look back to their California wages in their base period. Yeah, I mean, I would have to triple check on that, but I don't think so. But Deanna, do you have a different memory?
And another example where this came up was a woman was living in LA with her mother, but she had to leave for work, and her mother was high risk. So she ultimately had to leave the job she was currently in, and she moved with a friend to Seattle. So she was in Washington. But when she wanted to come back and take some caregiving time, she still was planning to come back to work in the California labor market, which is what the focus is on. And she still had wages that she had been taken out of her original employee's check during the base period. So it can be highly specific to people's situations. So definitely it's a situation we want to talk to someone, but it's possible.
Mm-hmm. I would say though, the EDD always says apply and we'll make the determination. So if I were moving to Texas to care for family, I don't actually have family in Texas, but maybe somebody will move there someday. Anyway, I would go, I might try it because you never know how long you're going to be in Texas. I mean, maybe that's not a legal advice, but the EDD does say sometimes it's best to apply and let them make the determination instead of talking yourself out of it. Because yeah, it's true. Maybe your intention isn't to keep working in California, but you have been paying into it for who knows how many years. So that's just my non-legal advice.
Right, and just to clarify, you certainly are still eligible for California SDI if you're temporarily or whatever, if you're caring for someone out of state, basically. So that's for sure. It's just, I'm thinking more of the situation where you moved for another job and then 6 months later you have to care for someone. That's where I'm not 100% sure and thinking maybe not, but like Jenya said, definitely apply and then let them make the determination.
I have a question. For mothers who have to go back to the disability, when mothers are put on disability due to work, maybe they can't lift or stand for their usual schedule, how do they transition from receiving the work disability to paid family leave without having a large part of their income lost? Because I had a friend, she's actually been put on bed rest. So in those instances, when a woman's put on bed rest or some things like that, how do we help them with that?
So are you saying she was put on bed rest early and so it probably would have ended up being even more than 4 months?
Exactly. She's a couple weeks behind me. So I'm 37. She was placed on bed rest at 30 weeks.
Okay. So yeah, that's a really good question. So as we discussed, pregnancy disability goes up to 4 months. And then if you're eligible for CFRA, that's another 3 months. If you are still disabled, after the 4 months, you can start using the CFRA for your continued disability. It's not the ideal, because it does eat into your bonding time, but you can do that. And then if you remain disabled even beyond the 7 months, there's a possibility that you could get additional leave through requesting a reasonable accommodation under the Americans with Disabilities Act or Fair Employment and Housing Act. There is good law that basically suggests that certain disabilities or certain pregnancy-related conditions are considered disabilities. And so you're protected under those laws. A really good example, well, your friend's example is good if she's a high-risk pregnancy and needs to go on bed rest. But where I see it come up more, and I've had clients dealing with this, is postpartum depression, where they may need more than the 7 months. And so definitely if someone runs into that situation, you know, we welcome them to give us a call, because it isn't quite as straightforward as just, you know, the pretty formulaic CFRA and pregnancy disability leaves. But yeah, that's definitely an option, and we've seen that be successful in some cases. Does that answer your question?
Yes, it does. Thank you so much.
Sure.
I wanted to chime in as well, if we have a second, Charlotte, that it is only the employee's choice to take pregnancy disability leave. So that means if, you know, maybe she can't lift 20 pounds, but they can still lift 10, just make sure any accommodations that are done before, you kind of write that in, you try to be as small as possible, because an employer may try to come back and say, hey, there's no job for you because you can't lift the vacuum, but little do they know they can still lift many other items that they need to carry during the day. So we want to make sure that they're not restricted from doing their job. So we start small with, you know, what is the absolute highest amount that you may not be able to lift, or what restriction. But if they can still do some, we want to kind of make sure that the employee is still eligible to work and have a reasonable accommodation, so she doesn't need to go into that pregnancy disability leave too early on.
Thanks, Diana and Rachel. So we only have time for one more question because we have a few more things just to address before we wrap up. And one question in the chat is, what can we do to reduce institutionalized racism? And for me, and everyone else, please chime in, I would say our advocacy, right? Advocating for more equitable laws, being part of the legislative process, use your voice. Like Mia said, for the bill for from 60-70% back to 55, the PFL claims expanding chosen family, making sure language access is accessible. I would definitely recommend, you know, trying to be part of our advocacy and legislation. Don't know, Mia, if you wanted to add some more to that.
Yeah, and thanks so much, Rosalba, for the question, because this is really important, right? And a lot of people are using the term now, systemic racism, and how we all need to do the work, but no one's actually saying what that means. So what that means is institutionalized racism and systemic racism is built into the structures and the laws of our country. And as you saw from the infographic we showed earlier, who are the people who are least aware and least able to take paid family leave, even though we're paying into it? It's people of color, it's Black people. We're paying into this program, we're still dying at birth, we're still not getting the rights we need, we're still getting discriminated at work. The best way to do that, in my opinion, is systemic change is through policy change. And that's why I got involved at the coalition. And I had no idea of this crisis. I thought, again, it was just a personal failing of I wasn't earning enough, I should have went and got another degree and all this stuff. When in reality, I'm a working person, a part of this country, and I should be able to have a healthy pregnancy and not die in birth. So my recommendation is, number one, go watch 0 Weeks. Definitely, we'll send the link out, make time, watch it, because that's the documentary that fired me up and brought me to the coalition. I had no idea who my assembly member was, what's a legislator, who's my senator. And I'm telling you, it sounds like a foreign language, but once you get involved in advocacy work, which I will put the link in the chat right now, go to that link and you can see the laws that we are working on this year. And as complicated as advocacy can sound, it's actually really simple. Know what laws you're fighting for, sign up at our form to figure out who's your assembly member, who's your senator, who's your congressional member. And there's links where you can put in your zip code and figure that out. And then you can talk to us and we educate people on how do you call your legislator about wage replacement? You know, you say, hey, this personally affects me. I'm a mom, I live in LA, and 60% already wasn't enough, and 55% is going to send us back, and we really can't afford that. My expenses go up, not down, when I have a child. Please vote yes on AB 123, which is the bill for wage replacement. So it's actually really simple, but I think for so long we have been not involved in this process, and I think that was by design, because they know if they get a bunch of tired and exhausted Black moms in the room, we are going to literally tear it up and like fix the system that's oppressing us. So yes, like constantly tell people that if you want to change systemic racism and uproot it, then we have to change our systems. And what affects our systems? It's our laws. So we got to work on that. We have to normalize activism. We have to normalize changing policies. We have to get involved in this work, because people want us to think that we're just waiting around for someone to change the law for us, when in reality, these legislators are not going to know what our challenges are if we don't speak up. I mean, look, how many Black people are actually in legislative leadership? It's very small. The number is tiny. I think Kamala Harris was like, what, the first Black senator or something? Like, you know, we need more representation. So watch 0 Weeks, go to that link, sign up on our form. It takes a little bit of time to fill out because you have to put in like details of your assembly member and all that. If you have any problems filling it out, let us know, but we definitely just want to expand our people power across California with more diverse voices, because no one knows what your challenges are better than you. And that's really what we hope to accomplish this year, is keep building that people power and change these laws.
Great.
All right.
Thanks. So yeah, let's, if you could go to the resources slide, Mia. Thanks for all those great questions. And, you know, next week will be our second training. So if you have more questions, go ahead, write that down, email us, and we can answer those during the second training session as well.
Okay, can everyone see the slides now? Because I'm having some issues. Okay.
Yep, it's we had some FAQs, but we'll go over those in the next one. Since y'all asked such great questions, I don't want to take up that time. And so this is our resources page. It will be, you know, if you need information regarding understanding more of paid family leave, we have hyperlinks here, great resources from Legal Aid at Work. They have really wonderful resources navigating pregnancy disability leave, PFL, and how these laws work together. And then, like I said, the SDI tutorial, the step-by-step guide, and tutorial training videos. This is all hyperlinked. We will provide this for you after the training. And on the next slide, for training 2, I just want to let everyone know we're going to review the laws again. We're going to go into paid sick and safe days, apply our knowledge and practice scenarios. So when you work with community members, your family, whoever, will be able to articulate this and make sure they're accessing their benefits. And EITC will be joining us then to talk about your rights and benefits there. And then on the next slide, I do want to highlight, as many of you, when you registered for the training, there's going to be an opportunity to become a community support person. This position will be an estimated 10 to 15 hour commitment from May 3rd to June 25th. There will be 10 positions open. And the application will open next week on April 15th at 6 p.m. I will provide all of this in email, but I do want to highlight it now. And the application will close on April 19th at 6 p.m. And applicants must complete the 3 virtual training hours, and that's this week and the next week, so the both training sessions. And once all the requirements you see here have been fulfilled, you will receive a $1,000 stipend. So I will be emailing everyone a one-pager that more describes this role and the 3 requirements you see here in greater detail, what the expectations are, so you know if you have the capacity or not to do so, and notify everyone once the application opens. And that's a wrap for our first training. Thank you so much for joining us today. We look forward to seeing you again next week at the same time. Mia, Rachel, Deanna, Jenna, I didn't know if you wanted anything else to say as we head out.
Nope, just thank you everyone for showing up and for learning about this and committing to share the information with your communities.
Thanks, everyone.
Thank you so much. See you next week.
Bye, everyone.
Bye. Thank you.